You cut your foot on a sharp sliver of flint, and in your world there's no doctor, no clinic, no pill, and no word yet for the thing that has already begun moving through your blood. The cut looks like nothing. By the next morning, the skin around it feels hot and tight. By the third day, a thin red line has started crawling up your ankle toward your knee, and the people around the fire go quiet when they catch sight of it. You are a living human being somewhere around 40,000 years ago, and the question pressing down on you is older than any language anyone has yet invented. How do you survive an infection in a world where nobody alive even knows what an infection is? Stay with that foot for a moment, because almost everything that kills a person in the ancient world starts with something this small. A scratch, a rotten tooth, an animal bite that barely broke the skin, a difficult birth. Long before antibiotics, before anyone understood germs, before a single human had ever seen a bacterium under glass, your ancestors were dying from wounds that you would rinse under a tap today and forget by lunchtime. And yet here you are, reading this. Every person alive descends from an unbroken chain of humans who met these infections face to face and walked away from at least enough of them to have children. So the real puzzle is not whether ancient people died from infection. Enormous numbers of them did. The puzzle is how any of them lived, and the answers that archaeologists have dug out of caves and glaciers and old teeth are far stranger and far cleverer than the word caveman ever suggested. Begin with your own body, because that was the first defense your ancestors had, and the only one they were born with. When that flint cut your foot, bacteria slipped through the broken skin and started feeding and multiplying in the warm tissue underneath. Your body noticed within hours. The heat and swelling you feel around the wound is your immune system flooding the area with cells that hunt invaders, and the fever that follows is not the infection winning. The fever is a weapon. Your brain deliberately raises your body temperature because many bacteria breed best at your normal heat and start to struggle when you push a few degrees past it. A person sweating and shivering by the fire 40,000 years ago had no idea why they felt like they were burning, yet that burning was their oldest inherited medicine, written into the body millions of years before the first stone tool was ever shaped. That inherited defense was powerful, and it was also not enough on its own, which is why the next part of the story is about other people. Picture yourself unable to walk on that foot. You cannot hunt, you cannot gather, you cannot keep up when the group moves across the landscape following herds and ripening plants. In a purely savage world, the kind people imagine when they hear the word prehistoric, you would simply be left behind to die. But the bones tell a different story, and one skeleton tells it more clearly than almost any other. In the 1950s, an archaeologist named Ralph Selecki was digging in Shanidar Cave in the mountains of northern Iraq when he uncovered the remains of a Neanderthal man who lived around 45,000 years ago. Researchers call him Shanidar 1, though the team gave him the nickname Nandy. When they studied his skeleton, they found a body that had been wrecked and then healed. A heavy blow to the left side of his face had damaged the bone around his eye socket, and he may well have been blind in that eye. His right arm was withered and useless, possibly amputated below the elbow, the bone worn down from years of disuse. He had healed fractures and damage to his legs that would have left him limping in constant pain. A man this broken could not have fed himself or defended himself. He lived for years in that condition anyway, which means other people fed him, moved at his pace, and protected him through injuries that should have killed him long before infection ever got the chance. The care itself was the medicine. Survival was something the group did together. Once you understand that ancient humans kept their wounded and sick alive on purpose, a new question opens up. What did they actually do for them? For a long time, the assumption was almost nothing, that early people were helpless against disease and simply suffered. The evidence now points somewhere much more interesting, because your ancestors were watching the natural world with an attention most modern people have lost, and they were turning what they saw into a working pharmacy. Take the willow tree. The bark of a willow contains a chemical called salicin, which the body converts into something closely related to the active ingredient in aspirin. Chew willow bark, or brew it into a bitter drink, and you get real relief from pain, swelling, and fever. Written records from ancient Sumer and Egypt describe willow being used this way thousands of years ago, and the knowledge almost certainly stretches back far deeper into the unwritten past. A person in pain from an infected wound, sipping a dark willow brew by firelight, was using the same molecule sitting in a bottle in your bathroom cabinet right now, just delivered by a tree instead of a factory. Honey is another example, and it is a strange one. Spread raw honey over an open wound and it fights bacteria in several ways at once. It is so thick and sugary that it pulls water out of bacterial cells and dries them out. It is naturally acidic, and many honeys slowly release small amounts of hydrogen peroxide, a genuine disinfectant. Ancient Egyptian medical texts list honey in hundreds of wound treatments, and hospitals today still use medical-grade honey on infections that ordinary antibiotics struggle to clear. Your ancestors did not know about hydrogen peroxide or acidity. They knew that honey on a bad wound helped, they remembered it, and they passed it on. Then there is the quieter knowledge, the kind that leaves almost no trace. Across the cold north, people packed wounds with sphagnum moss, the spongy moss that grows in bogs. It soaks up many times its own weight in blood and fluid, and it is mildly acidic and discouraging to bacteria, so much so that it was still being gathered by the ton to dress wounds during the First World War. Some groups let the larvae of certain flies clean dead and rotting flesh out of a wound, since the maggots eat the decayed tissue and leave the living flesh behind. It sounds horrifying, and it works well enough that surgeons brought the technique back in the modern era under the name maggot debridement therapy. The same trick, almost certainly, was being used around fires tens of thousands of years before any hospital tried it. The most remarkable proof of this plant knowledge came out of the hardened plaque stuck to a set of Neanderthal teeth. At a site called El Cedrón in northern Spain, researchers studied a young Neanderthal man who had lived around 50,000 years ago and who was clearly suffering. His jaw carried a dental abscess, a pocket of infection in the bone that would have throbbed with every heartbeat, and his gut held a parasite that causes severe diarrhea. When scientists, including Karen Hardy and Laura Wyrick, analyzed the plaque still clinging to his teeth, they found what he had been eating while he was sick. There was poplar, a tree whose bark carries salicylic acid, the same pain-killing compound found in willow and in aspirin. And there were traces of a penicillium mold, the kind of mold that gives us penicillin. A Neanderthal in agony from an infected tooth was chewing a natural painkiller and carrying the mold that would one day become the most important antibiotic in human history, roughly 50,000 years before a scientist in a London laboratory noticed that same mold killing bacteria in a dish. Sometimes the treatment went much further than herbs and dressings, all the way to cutting into the body. Across the world, from France to Peru, archaeologists keep finding ancient human skulls with neat holes deliberately scraped or drilled through the bone, a practice called trepanation. The French scientist Paul Broca studied many of these skulls in the 1800s and noticed something astonishing. Around the edges of many holes, the bone had grown smooth and rounded, which only happens in a living person whose body keeps repairing itself for weeks, months, or years after the operation. People were opening up skulls with stone tools, and the patients were living through it. Some skulls show 2 or 3 separate healed holes, meaning the same person survived the procedure more than once. Whether they did it to relieve pressure after a head injury, to drain an infection, or for reasons tied to belief, the healed bone is proof that your distant ancestors performed surgery, and that a remarkable number of people walked away from the table. None of this medicine would have meant much without the one tool that sits at the center of ancient survival, which is fire. Fire let people cook, and cooking quietly prevented infections before they ever began. Raw meat from a scavenged carcass swarms with bacteria and parasites, and heat destroys most of them, which is part of why the biologist Richard Wrangham has argued that cooking reshaped the human body itself over hundreds of thousands of years. A group that cooked its food was poisoning itself far less often than one that ate everything raw. Fire did more than cook. A blade or a stone heated in the coals and pressed against a bleeding wound would seal it and burn away the surface filth. A brutal treatment called cauterization that people used long before they could explain why it lowered the odds of the wound turning bad. Smoke drove off the biting insects that carry disease, and a fire kept a sleeping group a little safer from the infected bite of a mosquito or a rat. Water mattered just as much, in the opposite direction. Drink from a still pool fouled by animal waste, and you swallow the bacteria that cause severe diarrhea, which can drain the body of its fluids alarmingly fast. Ancient people learned which springs and streams ran clean, returned to them, and avoided the water that had sickened others. Some groups ate particular clays, and certain clays genuinely bind toxins and kill bacteria in the gut, which is why people across the world independently arrived at the habit of swallowing earth when their stomachs turned against them. There was one wound, though, that no group could avoid and that killed with terrible reliability, and it arrived with birth. When a woman gave birth in the ancient world, she was left with a large, raw wound inside her body, exactly the warm and bloody opening where bacteria thrive. An infection of the womb after childbirth, the same fever that filled European hospitals with dead mothers as recently as the 1800s, threatened every birth for hundreds of thousands of years. The women who survived owed their lives to clean hands, to knowledgeable older women who had attended many births, to protective plants, and to a great deal of luck. Every person alive descends from a long line of mothers who lived through that danger at least once. Teeth told a slower version of the same story. A cracked or rotting tooth opens a path for bacteria straight into the jaw, and from there toward the brain, and ancient skulls are full of abscesses that must have caused agony and sometimes death from an injury no larger than a chip of enamel. Faced with all of this, your ancestors defended themselves with something quieter than any herb, which was their own behavior. The lurch of revulsion you feel at rot, at waste, at a festering sore, worked as one of the oldest defenses of all, studied by researchers such as Valerie Curtis as a kind of inherited alarm that pushed people away from the things most likely to make them sick. Pulling back from a corpse, refusing spoiled meat, moving camp away from waste and away from the dead, every one of those reflexes lowered the chance of catching something long before anyone understood what they were avoiding. For the most vivid case of ancient medicine, though, you have to leave the caves and climb up onto a glacier. In 1991, two hikers in the Alps, on the border between Italy and Austria, found a body melting out of the ice. Everyone assumed it was a recent accident. It turned out to be a man who had died around 5,300 years ago, preserved so completely by the ice that his skin, his stomach, his clothes, and his tools all survived. The world came to know him as Otzi the Iceman, and he has since become the most thoroughly examined ancient human in history. The scientists who studied Otzi, among them the researcher Frank Meixner, found a man who was quietly very sick. Inside his gut they found the eggs of whipworm, a parasite that would have caused him pain and bleeding. When they sequenced the contents of his stomach in a study published in 2016, they found Helicobacter pylori, the same bacterium that gives people ulcers today, and a particularly aggressive strain of it. His joints were worn, his arteries were hardening, and he carried the ordinary load of aches that came with a hard outdoor life. He was a walking collection of infections and ailments, and he was still walking high in the mountains. What makes Otzi unforgettable is what he was carrying. Threaded onto leather cords, he had pieces of a fungus called the birch polypore. This fungus contains compounds that are toxic to certain bacteria and to intestinal parasites, the very kind of parasite living in his gut. A man with a whipworm infection was carrying a natural antiparasitic with him into the mountains. He was, in the most literal sense, a person walking around with his own medicine kit 5,000 years ago, treating an infection he could feel even though he could never have named the worm causing it. So your ancestors had inherited defenses in their own blood. They had the care of their group, and they had a real and growing toolkit of plants, fungi, and techniques. Step back far enough, and you can see disease shaping the human story at the level of the species itself, written into DNA we can now read directly out of ancient bone. Consider the plague. For most of history, people assumed the Great Plagues were a problem of crowded cities and the medieval world. Then, a team led by researchers including Eske Willerslev and Simon Rasmussen extracted DNA from the teeth of people who died in the Bronze Age, and in a 2015 study, they found Yersinia pestis, the bacterium behind the plague, in human remains around 5,000 years old. The disease that would later empty whole regions was already circulating among humans thousands of years earlier than anyone had proof of before. The threat your imaginary foot represents was not a rare accident in the ancient world. It was a constant pressure, and it was old. Pressure like that does something to a species over time, because the people who happened to carry stronger defenses were more likely to live and have children who inherited those defenses. There's a haunting piece of evidence for this hidden in your own genes. When modern humans spread out of Africa, they met and had children with Neanderthals, who had already been living in the colder, harsher north for hundreds of thousands of years and had adapted to its diseases. Researchers including Michael Danneman and Janet Kelso have shown that some of the immune system genes modern people inherited from Neanderthals helped our ancestors fight off infections they were meeting for the first time. The same inherited genes seem to make some people today more prone to allergies, as though the immune system, tuned long ago to attack ancient threats, now sometimes fires at pollen and dust. If you suffer through hay fever every spring, part of the reason may be an ancient bargain your ancestors struck with disease tens of thousands of years ago. All of this defense had taken shape in a world of small, scattered groups, and it would soon be tested in a way it never had before. When humans began farming and gathering into the first crowded villages around 10,000 years ago, they lived packed together with their animals and their waste, and a fresh wave of diseases like measles and smallpox crossed over from livestock and spread through the dense new settlements. The same closeness that raised the first towns gave infection ideal conditions, and the bodies your ancestors had shaped against the wounds of the wild now had to stand against the diseases of the crowd. It helps to grasp how much these defenses shaped the youngest members of every group. A child growing up in the ancient world met a steady stream of new germs early in life, and each fever they came through left their immune system stronger and better prepared for the next one. The body learns disease by meeting it, and the children who recovered carried that hard-won protection with them into adulthood. Around every child stood a whole group built to keep the young thriving, with mothers and grandmothers, aunts and older siblings sharing food, warmth, watchful eyes, and the plant remedies that eased a fever or cleaned a scrape. A child in that world rarely faced an illness alone, and that constant care, layered on top of a maturing immune system, is a large part of why so many of them grew up strong enough to raise children of their own. Other ancient threats left their own marks in the bone. Tuberculosis slowly bends the spine, and archaeologists have found its damage in human skeletons many thousands of years old, proof that slow, wasting infections walked alongside humanity for a very long time. The knowledge that protected these people lived in people, rather than in any written record. An older healer who knew that willow eased a fever, that this moss packed a wound while that one did nothing, that a certain root would empty a poisoned gut, carried real medicine that could only be kept alive by being taught to the young. When such a person died with their knowledge unspoken, the whole group lost it. That loss is part of why ancient people kept their elders close and fed them through the years when they could no longer hunt, the same care that kept the broken man in Shanidar Cave alive. The old held the memory of every wound the group had ever survived. Now bring all of it back to that foot, with the red line still crawling toward your knee. Knowing what we know now, walk through what actually keeps you alive. Your fever climbs and starts to cook the bacteria that thrive at your normal temperature. Someone in your group, instead of leaving you behind, brings you water and stays close, the way someone once stayed close to a broken man in Shanidar Cave. An older person who has watched many wounds packs yours with moss and willow and a smear of honey, working from knowledge that was learned through countless deaths and remembered across generations. Your body, carrying immune genes shaped by every plague your ancestors ever survived, does the rest of the fighting on its own. Most of the time, with all of this together, the red line stops, fades, and disappears. Sometimes it does not, and the group buries one of its own, and carries the lesson forward. That is the real shape of survival in the ancient world, and it looks almost nothing like the lonely brute crouched in a cave that the word prehistoric tends to summon. The people who came before you survived disease through patience, attention, memory, and care for one another, generation after generation, with no idea of the invisible enemy they were actually fighting. They could not see the bacteria, they could not name the fever, they could not explain why willow eased the pain or why honey cleaned the wound. They only knew that these things helped, that the sick sometimes recovered, and that you did not abandon a person just because they could no longer walk. Every one of those quiet decisions, repeated across tens of thousands of years, is the reason you are here to read this. You carry their fever in your blood, their willow in your medicine, their care in the simple fact that when you are sick today, someone brings you water and stays. The world has filled with hospitals and antibiotics and machines that can see a single cell, and underneath all of it, the oldest cure is still the same one that saved a broken man in a cave 45,000 years ago. You cut your foot on a sharp